Hello everyone, and welcome to the Demal Consult Career Academy YouTube channel. In today's video, we'll be focusing on one of the most important topics for those pursuing a career as a continuing care assistant in Canada, the interview process. If you're preparing for a continuing care assistant interview, you'll want to be confident and ready to answer common questions that potential employers might ask. We'll walk you through some of the most frequently asked continuing care assistant interview questions, along with tips and strategies to help you give strong, thoughtful responses. Whether you're just starting your continuing care assistant journey or looking to enhance your interview skills, this video is for you. Let's dive in. 1. Why did you choose a career as a continuing care assistant? I chose a career as a continuing care assistant because I have a strong passion for helping others and making a positive difference in their lives. I am particularly drawn to providing care for individuals who need support with their daily activities. Whether due to aging, illness, or disability, I find it incredibly rewarding to help people maintain their dignity and independence, while ensuring they feel safe, respected, and cared for. Additionally, the role of a continuing care assistant allows me to build meaningful relationships with patients and their families, which I find deeply fulfilling. The opportunity to support individuals through their recovery or daily routines aligns with my values of compassion, empathy, and commitment to healthcare. I am eager to contribute to a team that provides high-quality care and creates a supportive environment for both patients and staff. 2. How do you handle the physical and emotional demands of this job? I understand that the role of a continuing care assistant can be physically and emotionally demanding, and I am prepared to handle both aspects with care and professionalism. For the physical demands, I focus on maintaining my own health by staying active and practicing good body mechanics. I make sure to use proper lifting techniques and equipment to avoid injury, and I take regular breaks when necessary to stay energized and avoid burnout. I also understand the importance of teamwork, so I don't hesitate to ask for help if the workload becomes overwhelming. On the emotional side, I recognize that working closely with vulnerable clients can be emotionally taxing. I take time to practice self-care, whether it's through hobbies, spending time with loved ones, or engaging in mindfulness techniques. I also ensure I have a strong support network within my team, and don't shy away from discussing challenging experiences with colleagues or supervisors when necessary. This helps me stay emotionally grounded and focused on providing the best care for my clients. Overall, I maintain a balance of physical well-being, emotional support, and effective communication with my team to ensure I can continue providing compassionate and high-quality care. 3. Describe a time when you had to deal with a difficult or uncooperative client. How did you handle the situation? In my previous role as a healthcare aide, I worked with a client who was often uncooperative. When it came to personal care, particularly with bathing and changing, the client would become agitated and refuse help, which made the situation challenging. To handle this, I first made sure to approach the situation with patience and empathy. I understood that there might be underlying reasons for the refusal, such as discomfort, fear, or a lack of trust. I took the time to speak with the client and ask about their preferences, ensuring they felt heard and respected. I also provided reassurance, explaining each step of the process and why it was important for their health and comfort. I offered choices when possible, such as selecting the time for their care or allowing them to choose the type of products used. I always made sure to maintain a calm and positive tone, which helped build trust over time. Eventually, the client became more receptive to the care provided. Through this experience, I learned the importance of being patient, adaptable, and understanding when working with clients who may have cognitive or emotional challenges. It's crucial to respect their autonomy and offer them as much control as possible while still providing the necessary care. Before we proceed further in this video, I want to share something amazing that could change the way you prepare for your continuing care assistant interview. If you're feeling nervous about the process or unsure of how to give standout answers, I've got just the thing for you. Our ebook, Continuing Care Assistant Interview Questions and Answers, is your ultimate guide to acing your interview and securing your dream job. It's packed with the top questions you're likely to face, along with expert-approved answers to help you respond with confidence and professionalism. And that's not all. As a bonus, you'll also get free expert tips to help you pass your interview and master the STAR approach for answering even the toughest behavioral questions like a pro. Right now, we're offering an exclusive 50% discount, so this is the perfect time to grab your copy. Simply click the sealer or fourth wall link in the description box below and start preparing today. If you need more information or have any questions, feel free to chat with our online customer care representative on WhatsApp or email us. Don't wait. This is your chance to get ahead of the competition and walk into your interview feeling confident and prepared. Let's get back to the video and continue helping you ace your continuing care assistant interview. 4. How do you ensure the privacy and dignity of your clients while providing care? I believe that maintaining the privacy and dignity of clients is an essential part of being a continuing care assistant. First and foremost, I always respect the personal space and preferences of clients. I ensure that I speak to them with respect, maintaining a calm and professional tone, and always ask for their consent before providing any care, whether it's for personal hygiene, mobility assistance, or medication. In terms of privacy, I make sure that care is provided in a confidential and discreet manner. I close doors and curtains during personal care tasks, and I always ensure that conversations about clients' care are done in private, away from other clients or staff who do not need to be involved. I also understand the importance of following all privacy regulations, including confidentiality policies. And I make sure that I share sensitive information only with the appropriate team members involved in the client's care. Finally, always communicate with clients to understand their preferences, giving them as much autonomy as possible in decisions about their care. Empowering clients in this way ensures they feel respected and valued, which is key to preserving their dignity while I provide assistance. 5. What experience do you have working with patients who have dementia or other cognitive impairments? I have had the opportunity to work with patients who have dementia and other cognitive impairments in both home care and long-term care settings. In my previous role as a healthcare aide at ABC Care Home, assisted patients with daily living activities, including personal care, meal preparation, and mobility support. I have developed skills in creating a calm and structured environment for individuals with dementia, which I know is essential to reduce confusion and anxiety. I also understand the importance of using effective communication strategies, such as speaking clearly, using simple language, and offering reassurance to help patients feel more comfortable. I have worked with care plans tailored to the individual's needs, and I always make sure to engage with patients in a manner that promotes their dignity and independence as much as possible. In addition, I've had training on dementia care techniques and have learned the value of patience and empathy when providing support. Whether assisting with memory cues, offering emotional support, or ensuring safety, I strive to create a supportive environment that helps enhance the well-being of patients with cognitive impairments. 6. How do you manage and prioritize your time when caring for multiple clients? When caring for multiple clients, I understand that time management and prioritization are key to providing effective care. I typically start by reviewing each client's care plan before my shift begins, to understand their specific needs and any tasks that need to be prioritized, such as administering medication, assisting with mobility, or supporting personal hygiene. I make a list of tasks for the day and assess which clients may need more immediate attention. For example, clients who are more dependent or have complex medical needs will be prioritized, while still ensuring I attend to less urgent tasks. I also stay in communication with my team, so we can coordinate care and ensure no client's needs are overlooked. I remain flexible as well. Sometimes emergencies or unexpected needs can arise. So I adjust my schedule accordingly, while ensuring I follow up with clients I may have missed earlier. Time management tools like checklists or schedules help me stay on track. And I make sure to keep the environment organized to minimize distractions and avoid delays in providing care. Above all, I ensure that each client feels heard and valued, and that their well-being is the top priority, no matter how busy the day might get. 7. Can you explain how you would respond in an emergency situation? In an emergency situation, primary focus would be ensuring the safety and well-being of the client while also remaining calm and collected. First, I would assess the situation quickly to determine the severity of the emergency. If the situation requires immediate medical attention, I would call for help, or dial 911 right away and provide clear information about the emergency. Next, I would ensure that the client is in a safe position, if possible, and try to keep them as comfortable as I can while waiting for medical assistance. If there is an immediate risk such as choking or a fall, I would follow any first aid protocols I have been trained in, such as performing CPR or the Heimlich maneuver if appropriate and within my training. I would also make sure to inform my team and supervisor about the emergency as soon as possible, and document everything accurately, including the time, the actions I took, and any other important details to ensure that the incident is reported according to company and regulatory standards. Throughout the entire process, I would remain calm and compassionate to help reduce the stress and anxiety of the client and anyone else involved. It's important to stay professional and follow the procedures set by the organization to ensure the best possible outcome for the client. 8. How do you work as part of a healthcare team? As a continuing care assistant, I understand that providing quality patient care requires a collaborative approach. I work closely with nurses, doctors, and other healthcare professionals to ensure that the needs of the patient are met comprehensively. I focus on clear and open communication, sharing important observations about the patient's condition with the team to ensure we are all aligned on care plans. I am always willing to listen to the insights and suggestions of others on the team, whether it's regarding patient care techniques, safety protocols, or emotional support for patients and their families. I respect the expertise of each team member and value their input in providing holistic care. I also make sure to follow any instructions or treatment plans set by the nurses or doctors to ensure continuity and consistency in care. Additionally, I am proactive in asking questions when needed and taking initiative to help wherever necessary, whether it's assisting with patient mobility, monitoring vitals, or supporting families. Overall, my focus is on ensuring the patient's well-being while fostering a positive and supportive environment for the entire healthcare team. 9. What steps do you take to maintain client safety and comfort during daily activities? As a continuing care assistant, my top priority is always the safety and comfort of the clients I care for. To maintain both, I begin by assessing the environment and the client's physical condition before assisting them. This includes checking for any potential hazards, ensuring that the area is clear of obstacles, well lit, and that mobility aids such as walkers or wheelchairs are in good condition. When assisting with transfers, such as moving from a bed to a chair or helping with toileting, I always use proper lifting techniques and assistive equipment when needed to prevent falls or strain. I also ensure the client is positioned comfortably and securely. Clear communication is crucial in making sure the client feels comfortable and informed about what is happening. I always explain the process, check in with the client about their preferences, and ask if they are experiencing any discomfort. This gives them a sense of control and helps me adjust the care to meet their needs. During daily activities, I continuously monitor the client's physical and emotional state, If they express discomfort or pain, I adjust the activity accordingly and make sure to notify other healthcare team members if necessary. I also ensure I'm always prepared for emergencies by knowing the appropriate protocols and acting swiftly in case a situation arises. Finally, I tailor the assistance to each client's unique needs and preferences, ensuring their dignity is maintained throughout the process, whether it's with personal care, grooming, or mobility support. This individualized approach allows me to provide care that is both safe and comforting. 10. How do you ensure proper documentation and record keeping of your client's care? Ensuring proper documentation and record keeping of a client's care is essential for providing high-quality care and maintaining the safety and well-being of the client. I make sure to document all care activities as soon as they occur, which helps ensure accuracy and prevents missing any important details. This includes tracking vital signs, medication administration, changes in the client's condition, and any assistance provided with activities of daily living. I also prioritize confidentiality and follow privacy laws, such as the Personal Health Information Protection Act in Ontario, or similar legislation in other provinces. I ensure that all documentation is completed securely, whether in electronic or paper format, and that client records are stored properly to prevent unauthorized access. When documenting, I ensure that my notes are clear, concise, and professional. I use objective language and avoid assumptions or subjective comments, focusing on significant observations or changes in the client's condition. Additionally, believe in clear communication with the healthcare team, sharing relevant information during shift handovers and updating care plans when necessary. If there are any immediate concerns, I make sure to bring them to the attention of supervisors or nurses to ensure coordinated care. Lastly, I review and update care records regularly to ensure that they are complete and reflect the current needs of the client, following all guidelines set by the agency or healthcare facility. By doing this, I can ensure that all documentation is accurate, secure, and compliant with legal and organizational requirements. Do you have questions for us? When asked, "Do you have any questions for us?" in a continuing care assistant interview for a position in Canada, you could respond by asking thoughtful questions that reflect your interest in the role and your commitment to patient care. For example, you might ask about the day-to-day responsibilities of the position, how the organization supports continuing care assistants in their professional development, and how the team collaborates in providing care. It's also helpful to ask about opportunities for further training or advancement, the support systems in place for staff, and how the organization ensures a positive work environment. Additionally, you could inquire about the specific patient care needs you will be addressing and what resources are available to help you succeed in your role. These questions show your dedication to both your personal growth and delivering the best care possible to patients. That wraps up our video on continuing care assistant interview questions and answers. We hope these tips help you feel more confident and prepared for your upcoming interview. Remember, the key to success is not only knowing the answers, but also showing your passion for helping others and your commitment to providing exceptional care. If you found this video helpful, don't forget to like, subscribe, and share it with others who might benefit. Thank you for watching, and best of luck with your interview preparations. See you in the next video.